You may be able to prevent or reduce acid reflux symptoms with a few lifestyle changes, including eating dinner earlier, adjusting your sleeping position, and avoiding certain acidic foods and drinks. Most of us are all too familiar with the painful, burning sensation in the center of the chest that's associated with heartburn. In fact, up to 28% of adults in North America experience gastroesophageal reflux disease, GERD, a common condition that causes heartburn. GERD occurs when acid is pushed up from the stomach back into the esophagus, which leads to the heartburn sensation. Although people often use medications to treat acid reflux and heartburn, many lifestyle modifications can also help you reduce symptoms and improve your quality of life. Here are natural ways to reduce your acid reflux. Chew gum. A few older studies have shown that chewing gum may help decrease acidity in the esophagus. Gum that contains bicarbonate appears to be especially effective, as it can help neutralize acid to prevent reflux. Chewing gum can also increase saliva production, which may help clear the esophagus of acid. Elevate the head of your bed. Some people experience reflux symptoms during the night, which can affect sleep quality and make it more difficult to fall asleep. Changing the position that you sleep in by elevating the head of your bed could help reduce symptoms of acid reflux and improve sleep quality. People who used a wedge to elevate their upper body while sleeping experienced less acid reflux compared with when they slept flat. Eat dinner earlier. Healthcare professionals often advise people with acid reflux to avoid eating within the 3 hours before they go to sleep. That's because lying horizontally after a meal makes digestion more difficult, potentially worsening GERD symptoms. According to one review, eating a late-night meal increased acid exposure when lying down by 5%, compared with eating earlier in the evening. Opt for cooked onions instead of raw. Raw onions are a common trigger for acid reflux and heartburn. Study in people with acid reflux showed that eating a meal containing raw onion significantly increased heartburn, acid reflux, and burping, compared with consuming an identical meal that didn't contain onions. More frequent burping might suggest that more gas is being produced. This could be due to the high amounts of fermentable fiber in onions. Raw onions are also more difficult to digest and might irritate the lining of the esophagus, causing worsened heartburn. Whatever the reason, if you think eating raw onion makes your symptoms worse, you should avoid it and opt for cooked onions instead. Eat smaller, more frequent meals. There's a ring-like muscle known as the lower esophageal sphincter, where the esophagus opens into the stomach. It acts as a valve and normally prevents the acidic contents of the stomach from going up into the esophagus. It typically stays closed but may open when you swallow, belch, or vomit. In people with acid reflux, this muscle is weakened or dysfunctional. Acid reflux can also occur when there's too much pressure on the muscle, causing acid to squeeze through the opening. Unsurprisingly, most reflux symptoms take place after a meal. It also seems that eating just 1 to 2 large meals per day may worsen reflux symptoms. Therefore, eating smaller, more frequent meals throughout the day may help reduce symptoms of acid reflux. Maintain a moderate weight. The diaphragm is a muscle located above your stomach. Normally, the diaphragm naturally strengthens the lower esophageal sphincter, which prevents excessive amounts of stomach acid from leaking up into the esophagus. However, if you have excess belly fat, the pressure in your abdomen may become so high that the lower esophageal sphincter gets pushed upward, away from the diaphragm's support. This condition, known as hiatal hernia, is considered the leading cause of GERD. For this reason, some studies suggest that losing at least 10% of your body weight could significantly decrease symptoms of GERD in people with the condition. Achieving and maintaining a moderate body weight can help reduce acid reflux in the long term. However, if you're interested in this approach, make sure to speak with a healthcare professional to assess whether it's right for you, and if so, how you can lose weight safely and sustainably. Limit your alcohol intake. Drinking alcohol may increase the severity of acid reflux and heartburn. In fact, some studies have shown that higher alcohol intake could be linked to increased symptoms of acid reflux. Alcohol aggravates symptoms by increasing stomach acid, relaxing the lower esophageal sphincter, and impairing the ability of the esophagus to clear out acid. Avoid mint if needed. Peppermint and spearmint are common ingredients used to make herbal tea and add flavor to foods, candy, chewing gum, mouthwash, and toothpaste. However, they also contain certain compounds that could trigger heartburn in some people. For instance, some studies indicate that peppermint oil could decrease lower esophageal sphincter pressure, which may cause heartburn. Don't drink too much coffee. Studies have found that coffee temporarily relaxes the lower esophageal sphincter, increasing the risk of acid reflux. Some evidence also points toward caffeine as a possible cause. Similarly to coffee, caffeine relaxes the lower esophageal sphincter, which could cause reflux. Nevertheless, although several studies suggest that coffee and caffeine may worsen acid reflux for some people, the evidence is not entirely conclusive. For example, one analysis of observational studies found no significant effects of coffee intake on the self-reported symptoms of GERD. Yet, when researchers investigated the signs of acid reflux with a small camera, they found coffee consumption was linked to greater acid damage in the esophagus. Thus, whether coffee intake worsens acid reflux may depend on the individual. If you find coffee gives you heartburn, it's best to simply avoid it or limit your intake. In conclusion, acid reflux can be a painful and uncomfortable condition, but there are natural remedies that can help provide relief. By eating smaller, more frequent meals, avoiding trigger foods, and staying upright after eating, you can help prevent acid reflux. Mindful eating, drinking plenty of water, and using ginger or chamomile tea can also provide relief. Additionally, maintaining a healthy weight, quitting smoking, and limiting alcohol consumption can help reduce symptoms. Finally, managing stress and considering herbal remedies like licorice root, slippery elm, and marshmallow root can also be effective. By incorporating these tips into your daily routine, you can manage acid reflux and improve your overall digestive health. Thank you for watching this video on natural remedies for acid reflux.